Okay, well, let's go ahead and get started, everybody. Thanks so much for joining us this afternoon for the next in our series of webinars about making Medicaid work for you. We think we've got a really exciting program for you this afternoon because we're going to be talking about filing Medicaid claims. I don't know if that sounds exciting. I hope it does because you're here. But also the really exciting news is we've got representatives from all three of our managed care organizations here to talk through their processes and share some insights, and we're just excited to have them with us. So I'm going to go through these announcements rather quickly this afternoon so that we can get right to all the good content. I want to welcome you again. My name is Tanya Dorf-Bruner. I'm the executive director here at Oral Health Kansas, and again, just glad that you could all be with us. So before we get into the meat of it, I just want to share a few logistics. And if you've been with us for the last couple of weeks, you'll remember these logistics. We'll use the Q&A box for any questions throughout the webinar. If any questions come up as we're going, please just put them in the box and we'll get to as many of those as we can. As always, if we can't get to them all or we run into a question we don't know the answer to at the moment, we'll be following up with you about that and put together a frequently asked questions document with all those answers. If you have technical questions or anything, you can either email us or put a question in the chat. And as always, there'll be a total of 3.5 dental CEs available for participating in this series. So if you do need CEs, please put your name and address in the chat and we will capture that. So if you've been with us, you kind of probably can do this part of the background on your own now. But again, this is part of the Pathways to Oral Health project. It's an initiative that Oral Health Kansas is leading with many of our partners. It's all around three different things: supporting dental professionals in becoming successful Medicaid providers, ensuring we've got educational programming available for dental professionals and people with disabilities, and then working on communication tools to help break down barriers. And we'll talk more about that actually in a couple of weeks. Hopefully you've seen this graphic too. This is just, we're kind of proud of all the partners that are involved in this Pathways to Oral Health initiative. You can see the Dental Association, Community Care Network of Kansas, all of the managed care organizations, and many others are a part of this initiative. Specifically, this webinar series is sponsored by the Kansas Dental Association and Oral Health Kansas. We are partners in this series, and it is funded by an ARPA grant through the Department of Health and Environment Division of Healthcare Finance. So with no further ado, I'm going to turn this over to our dental Medicaid facilitator, Brian Thompson, to walk us through the agenda and get us started. And Brian, you're on mute, so we haven't heard anything.
Sorry about that. Thank you, Tanya. I'm glad you're all here today. We think we have a lot of very important information for you, and we will be sharing our slides and the recording later, so you'll be able to go back to anything you might have missed. The claims process can be complicated, and we understand how important that is for you as providers. So we're grateful to have all three managed care organizations, or MCOs, with us here to explain their processes. The web links on this slide that you see now take you to their provider portals. Rather than me droning on, let's allow each of them to explain their claims processes. And we'll start with SkyGen, which is the dental vendor for Healthy Blue. They're represented by Billie Jean Hubbard. So take it away, Billie Jean.
Thank you, Brian. If we could move on to the next slide. My name is Billie Jean Hubbard. I'm with SkyGen. I'm the third-party administrator on behalf of Healthy Blue. We handle just dental claims for Healthy Blue. If we could move on to the next slide, please. So I wanted to show what the member ID cards would look like if a member were to present any of the cards for Healthy Blue. The top one there is what the Medicaid card would look like. If they have Medicare, as with Healthy Blue, in other words, they're dual complete, kind of like a V-SNP plan, they would have that middle card where they would just have the Medicare with Healthy Blue and then Medicaid with a different vendor, not Healthy Blue. That last card is the dual complete card where they would have both Medicare and Medicaid combined, and that is what that card would look like. If we can move on to the next slide, please. We utilize several features to be able to check eligibility or submit claims, authorizations, one being the Dental Hub. I provided the link there. You would create an account if you don't already have one, and then you would have access once you've created that account to be able to check eligibility, submit claims, authorization, pull your remits, pull the provider manual, as well as your fee schedule. Other ways also to check eligibility and such I will get into, but one being is via phone, and then also if you have like a clearinghouse that you utilize to check eligibility and such. We do have a live webinar that we offer every other Thursday from noon to 1 p.m. Central Standard Time. That link is also listed there. If you don't have time for that live webinar, we also have a pre-recorded version that's shortened on there too that you can watch at any time, so 24/7. And then also we have a PDF that you can download. We call it our Quick Start Guide that you can glimpse over to check anything that you need to know without having to attend any of the webinars. If you run into any wall with the Dental Hub for any reason, I also provided the technical support phone number right at the bottom there. Next slide, please. So checking eligibility on the Dental Hub, this is kind of what it looks like. I provided a little snippet there. You can check by also phone number, which I provided the phone number there, which is our customer support center phone number. And you go through like an automated system to be able to check eligibility. And you also have the option to check eligibility with a live representative too. Next slide, please. So this is what the process would be when you're checking eligibility. So first you would put in the patient's information. Since the Dental Hub is not just for Healthy Blue, there's lots of payers on there. You can filter which payer you're needing to check eligibility for, which is why it does prompt you which payer you're looking to check eligibility on. And then you have the option to select which payer, which practitioner and location that you're trying to check eligibility for to make sure that your location's in network and such. And then the step 3 there just gives you a kind of a preview of what eligibility would look like for a member. Then there are 3 boxes right below there that are in dark gray where you can do like a cost estimator, and then submitting a claim or authorization are your 3 options there at the bottom. Next page. This is what eligibility would look like when you're checking it. So the light blue one means that they're good to go, both for provider and location, as well as the member. The middle one would be with caution that there could be a combination of 2 issues, either that the treating practitioner that you're checking eligibility on or the location. There's a conflict, in other words, so either the provider is not in network or the location's not in network. And then the last one there, which is in bright red, I would not advise to proceed on because that either the member does not have eligibility or all 3 issues where the member is not eligible, the provider's not in network, or the location. And so that would show up red. Next page, please. So I wanted to provide our main contacts as far as mailing addresses and the payer ID. So the payer ID up at the top there is Scion, that's to submit claims and authorizations. Next is the mailing address to submit authorizations, followed by the address for claims, and then the address for corrected claims, which is different than the claims address. So just wanted to notate that. And then for auth appeals as well as claim appeals, those addresses are there too for you. Next page, please. To submit a corrected claim, there's a couple ways of doing so, one being on the Dental Hub. So on the option of the Dental Hub being able to search for the member, you can either search by the member, like the member ID number in the data service, or claims that were submitted on the Dental Hub. You can actually look at your search history, your status history, and be able to correct it there. And those are the directions on how to do so on the Dental Hub. Next page, please. Oh, I think you went up instead of down. Next page. There we go. To submit a corrected claim on the clearinghouse, these are the methods to do so. So the frequency code 7 is that you're basically correcting the code, or correcting the claim, you're replacing the claim. 8 is to void the claim. And so that is how you would do a corrected claim via clearinghouse. Next page, please. And then to submit a corrected claim via mail, I did provide the mailing address there as well. In box 35, you would want to notate the claim number that you are correcting, also known as an encounter number. And then you'd also want to specify in that remarks box what it is you're changing on that corrected claim, such as maybe you're adding a diagnosis code or changing the code that you originally had billed, such of that sort. Next page, please. Our timely filing for initial claims is 180 days from the date of service. A timely filing for an initial claim for a secondary is 180 days from the date of service, or I'm sorry, not from the date of service, from the EOB of the primary. And then the third option there, which is for corrected claims, you have 365 days to do a corrected claim from the date of service. And then for appeals, you have 60 days from the denial date to submit an appeal, plus an additional 3 days for mailing time that is authorized. Next slide, please. So we offer several payment options. The first two listed there is EFT through Zealous and then virtual credit card through Zealous. There are fees associated with those. Not fees from Zealous, at least for the virtual credit card, but essentially your credit card processing company, depending on what company you use, the fees could vary. So something to take note of. However, we do have a no fee EFT option that you can also enroll into. And those directions on how to enroll there, you can either go to that website, or if you have any issues or any further questions, there's also their email address as well as their phone number listed there. And we still offer paper check as well for payment option. However, I don't recommend it just because it's the slowest option out of all options. And obviously you want to get paid as fast as possible. I did want to elaborate that our turnaround processing time from the minute that we get the claim, depending on what method you submit the claim, from the minute that we get the claim in the door, from then to the time that we process the payment is 30 days. So usually it's much faster than that. It's typically about 14 days, so 2 weeks in other words, but we are allocated a total of 30 days if needed be. Now, obviously around holidays, they'll be slightly delayed of that 14 days, but generally, again, the turnaround time from the minute we get the claim and process it to get the payment out the door to you is 14 days. Next slide, please. So I wanted to provide our key contacts for every single department that you could ever need. First being, again, is the Dental Hub, which the website is listed there, and then their tech support phone number if needed be. I also specified some things that you would be utilizing or needing to reach out to the Dental Hub for, or the website, which would be to gather your provider manual, your fee schedule, things of that sort. Then I also have the provider call center phone number, and again, ideas of why you might need to reach out to them. So general questions, benefits, claims, authorization status, things of that sort. Next would be for contracting and their phone number, as well as the website that you'd go to and entering the code Kansas, or KS in other words, to start the contracting process. And the reason that you would be contacting credentialing would be if you're needing to credential a provider with a new location or tax ID number, things of that sort. And then I'm sorry, that's contracting. For credentialing, then I also provided their phone number as well as their website too. And again, reasons for needing to reach out to them too. And then the Zealous and ePayment Center are both their phone numbers there too, if you ever need to reach out to them, as well as their email address. And then I provided the provider relations email address should you ever need to reach out to any of us here in provider relations. Next slide. I appreciate you guys taking time out of your day to listen to me, and I will pass the totem pole over to Brian. I think you're on mute, Brian.
Sorry about that. Thank you, Billie Jean. Next up is Eric Rolls. He represents Centene Dental Services, which operates Sunflower Health Plan. You're on, Eric.
Thanks, Brian. Hello. Well, as he said, I'm Eric Rolls, one of the 2 provider relations representatives for Sunflower Health Plan. And so we're going to talk a little bit about claims today, but first I wanted to let Dr. John Dane, who serves as our Sunflower Health Plan dental manager, speak briefly for a moment. So take it away, John. Thank you, Dr. Dane.
Here we go. Finally got my thing here. Good to see everybody here today. Glad to have the attendance about claims. A little bit about my background. Yes, I was the state for Missouri. I was also the dental director for MoHealthNet in Missouri. But beyond that, I was a Medicaid provider for 30 years and have a lot of experience on the provider side and filing claims. I survived an audit by MoHealthNet. Opinions and feelings that way. Then I worked also on the other side of things. I have been a claims review consultant as well as on the administrative side with MoHealthNet. I'm happy to share insights with anybody who is interested in contacting me. There you go, Eric. I'll give it back to you.
Thanks, Dr. Dane. All right, we'll go to the next slide. All right, so again, we're Centene Dental Services. And so we have 3 types of programs. We do Medicaid, we have a healthcare insurance marketplace plan, and we do Medicare. We have 4 million members in 27 states. So that's just a little bit about us, and let's go to the next slide. All right, so here is the ID card they'll likely present when they come to your office. If you ever forget what it looks like, they do have it in the provider resources section on our portal. So that's always helpful. And now there are the populations you'll see in the Medicaid program on the left. It is important to know which population you're working with because there are slight variations. So it's just because something's covered for a Title 19 child might not be the same as a Title 19 adult. So just good to know which population you're working with. All right, so let's go to the next slide, please. All right, so our website is centenedental.com. And so on our website, you can submit claims, you can submit authorizations, you can check eligibility, and you can review your EOBs if you register as a payee. So, and the other thing is when you register, there's multiple ways to register. Payee is going to give you access to everything, all locations, all providers, and all claims. But then some people at your office may not need all that access, so you can limit other people to just a location or just a provider, depending on their duties at your office. So that's how you'll register for our website, and you don't have to register, but I do highly recommend it because it is going to help you interact with us easier. All right, let's go to the next slide, please. All right, so on our website is the code search lookup, and when someone asks me about a denial, I many times have to direct them to this portal part of the website because it kind of goes over the coverage. So we'll just go quickly in a clockwise. So you put in the year, you're going to select Medicaid, you're going to select Kansas. And then when I was saying product, this is where you're going to select the different groups. Again, so in the screen, you see this would be a Title 19 adult. So you'll put that in, you'll put your code in, and you'll hit search. The clinical policy will pop up to the right. So you'll have that to get a better understanding of what my doctors are going to look at when they're reviewing some of your requests. You'll see it says prepayment review just to the left of that. That means it's covered and you can perform the service whenever you're ready. But when you submit the claim, my doctor is going to want you to attach an additional item to the claim. Some codes are going to need prior authorization. And so it'd be flagged yes if it did, unless an emergency. And so you'll submit that to us and they'll let you know within 7 days. And now most importantly is you'll see where it says D7210. You always want to click on that when you're looking at benefits because it's going to go over other limitations about the code, the frequency. And then if it does require prior authorization, it'll tell you what my doctor is going to want you to attach so they can make a decision quickly so you can get on with your day. So always want to click that. So let's go to the next slide, please. All right, so some codes do need prior authorization. You can submit them in 3 ways. It's the same way as claims. You can do a clearinghouse, paper, or on our portal. They'll be determined within 7 days, calendar days, and then they are good for 180 days, but then the member must be eligible on that data service. So if you get an approval and then it's 3 weeks later, time to do the service, you do want to still make sure they're eligible on the date you do the service. All right, so that's prior authorization. Let's go to the next slide, please. Okay, so claims. So claims and authorizations are the same in how you can submit them. You can use a clearinghouse, paper, or our portal, whatever works best for you. So timely filing is 180 days from data service if we are primary. If we are secondary, which does happen with some of the children, especially in Medicaid, it's 180 days from the primary EOB. So whenever you bill that primary insurance, they're going to send you a remittance. And then whatever date is on that, you have 180 days from that to bill us as secondary. Next slide. So just a little bit more about COE. So if a member has a primary, you must bill them first and then come and bill us secondary. And so the most common question I get here is, what if the code isn't covered? That's okay because you don't determine what's covered by the primary. You're just going to follow all the rules and bill them and then bring that remittance to us. So like braces aren't covered for some plans, and that's okay. It'll deny for not covered and you can still bill us as secondary and we'll process accordingly. So that's when we are secondary. So next slide, please. Frequently asked questions. There are appeals and grievances. The information is on the screen as well as reconsiderations. So that is there when you need it. And you can always reach out to your provider advocate for how to file that when that day comes. Hopefully it isn't too often, but it is an option should you choose to need it if you enroll, and we hope you do. Next slide. And then here's all our contact information that you might need. So I'll just highlight the basics. So my team is Dental Provider Relations with an S at Centene.com. And even if you're not a provider right now, we welcome any questions you have. So please email us. Just put your state, your tax ID, and your question, and it'll get routed to me or my counterpart, Tiffany, and we'd be happy to talk to you. If you ever have a quick question or want to check eligibility for a member, you could use the phone number. Credentialing, if you ever have a question about your credentialing, and then if you're a new doctor and you're ready to sign up, you would email Dental Network at Centene. And then there's the few other contacts as well that might be needed down the road. And next slide. And so that's all I have, but I do want to thank you for listening, and I really appreciate the time and hope to hear from you soon. So thank you so much.
Thank you, Eric. And as Tanya mentioned earlier, if you have any questions, please put them into the Q&A box. We move now to United Healthcare Community Plan. Their representative, Casey Burse. It's all yours, Casey.
Hi, thanks, Brian. My name is Casey Burse, and I am a provider relations advocate for United Healthcare, one of 3. And we also have Jennifer Martinez and Kathy Schmidt, and we share the state of Kansas. You can go to the next slide. The Dental Hub is going to be your go-to website for your practice's administrative task. You can submit claims, you can make edits, instant edits that help you avoid errors, submit prior authorizations, and you can process claims in real time. Next slide, Brian. The Dental Hub does have a bi-weekly webinar on Thursdays at 12. They'll help you get set up, answer questions. They do also have some pre-recorded webinars. I have listed their website, email, and then phone number for questions or technical support. Next slide. Next slide, Brian, please. This is going to be a card that you'll see members bring into your office there. It does have a number that you can call to check eligibility, and just always remember that just because one of your patients walk in with this card does not mean that they do have an active plan. So you always want to make sure that you are verifying eligibility. We recommend verifying that eligibility the date of service. Next slide. So I'll talk about authorization and submission. We do make a determination on standard authorizations within 2 days. And then for expedited, we do that within 24 hours. You can appeal a denied authorization 180 days from that date. They do expire 180 days. If you have questions regarding prior authorizations, the number there is on the screen. You should be able to pull up that prior authorization on the Dental Hub as well. Next slide. Claim submission and timely filing. You could submit on the Dental Hub, paper or electronically through your clearinghouse. Timely filing is going to be 180 days from date of service. Secondary claims would be 180 calendar days of the primary's determination. And then you would have 365 days to submit a corrected claim. Next slide, Brian. A corrected claim should only be submitted when the original claim or service was paid based upon incorrect information. Examples of corrections for a prior paid claim are incorrect provider MPI, payee tax ID, incorrect member, procedure codes. A corrected claim should be submitted electronically through your clearinghouse, through the Dental Hub, or by paper. You just want to make sure that you only submit a corrected claim if that claim, if you needed to make changes on the original claim. Next slide. Payment for non-covered services. When non-covered services are provided for Medicaid members, providers shall hold members in United Healthcare Community Plan harmless. So basically, it just means that if you are going to do a procedure that is not covered, that you have informed the member and given written acknowledgement regarding the proposed treatment plan and the associated costs that may be that may come from that treatment. Go ahead, Brian, next slide. Tips for successful claim experiences. Just to not let claims grow or go unresolved. If you're having issues with claims paying or processing, you can call provider services immediately. If you're not getting the help that you need through provider services, you can contact one of us provider advocates, so myself, Kathy, or Jennifer, and we would be happy to help figure out what's going on with your claims. A lot of common denial codes that we see are BMPI, not registered with the state. So you just want to make sure that when you're setting up the dental hub that you are entering the correct billing MPI that is also listed with the state. We also see a lot of duplicate claims. So that would just be a claim that needed some sort of correction and was just sent in as if it was a new claim. And go ahead, next slide, Brian. Next slide. So the next two slides are just going to be some information that you may need to contact United Healthcare. And I know we only have a few minutes left, so I won't go over that, but it does have our addresses and phone numbers, and it will be part of the slide deck that Brian will provide after the presentation. But wanted to at least give a few minutes because I know claims issues and there could be some questions, and I wanted to allow some time for that. So thank you, and back to you, Brian.
Okay. Thank you, Casey. We've hit you all with a lot of information in a very short time. So just a reminder, we will be sharing the slides and a recording of this meeting in case you need to go back and look again. We have a lot of resources that are available to you on our Pathways to Oral Health website. On this next slide, you'll see a link to our blog page where you can read about a variety of pertinent topics. And we also have a provider guidance document that's specifically about filing Medicaid claims. Now, the MCO reps all say that your best bet is to submit claims through their provider portals, but you can also do it through the KMAP portal, and the instructions for doing that are included in this document. We also have some resources for you on the Oral Health Kansas website, including frequently asked questions, enrollment information, list of covered codes, that sort of thing. And then I'm here to help you. So please reach out to me by phone or email whenever you need any help, and I'll try to do the best I can. And with that, I'll turn it back over to Tanya.
Thanks, Brian, and thanks, Casey and Dr. Dane and Billie Jean. That was a lot of great information. We are very close to our time, and I know that we went through a lot of things quickly, and hope you'll be able to look at those links later in the slides. But I did want to maybe not do our closing announcements, but cover a question in the chat, which is somebody's asking, are there very many procedures that you pay as a secondary? And I think that's probably for any of the MCOs, if somebody would like to answer that question. Also, while you're doing that, Jennifer, there's a request for your contact information. So if you could put that in the chat, that would be great. Does anybody want to answer, or are there very many procedures you pay as a secondary?
Yeah, I can go ahead and answer that. So as long as if it's a covered benefit for Medicaid, then yes, we would cover it.
Mhm.
The only obstacle that generally you're going to run into as a secondary with Medicaid is if the primary pays more than Medicaid allows. So long as if the primary do not pay more than what Medicaid allows, then essentially Medicaid would pick up the difference. So as long as if it's a covered benefit.
That sounds great. I appreciate that. There's a question that I definitely do not know the answer to in the chat. Can you touch base on the required CARC code needed on the claim when you are secondary?
So typically, I can answer that. Typically, the primary insurance puts that CART code on their EOB. And so generally you don't have to include the CART code as it is on the primary EOB. But if it's not on the primary EOB, you could go on a website and just check to see what that CART code would be, and just write it in on the primary EOB.
That's helpful. Thank you so much, Casey. We are at our time, so I don't want to keep anybody any longer. If you do have more questions, please just feel free to email us. We will get those answers to you. And as I said, we're going to be putting together a frequently asked questions document. Just a quick commercial there because our conference is coming up and we'll share more about that next week. So please join us back here at the same time next week. We're going to be talking about opportunities in the Medicaid program, and we'll be having a lot more information for you then. Thanks again for being with us this afternoon, and have a great rest of your day.